A local physicians group is taking on the insurance industry.
They're especially angered by the death of a young woman who may have lived had she gotten the right medicine in time.
The King 5 investigators have found how this case exposes problems that any one of us could face if our insurance company rejects a doctor's prescription. Chris Ingalls explains why some doctors believe that's happening more often.
Chanel Bunce was a senior at Auburn High, where the developmentally disabled 18-year-old had some rough times fitting in. Then came perhaps the biggest night of her young life. For homecoming of 2008, a boy asked her on her first date.
She said she felt normal for once, and she felt like she was Cinderella. For me, there's no more that you can ask for your kid to be happy.
But it wasn't long after that glittery night that Chanel started to feel sick.
She told the doctors that her joints were hurting her, and I thought to myself, how can her joints be hurting her? She's only 18.
After repeated visits to the nearby hospital, Chanel was diagnosed with a rare inflammatory disease known as Stills. She ended up in the hands of Dr. Gregory Gardner, one of the most respected rheumatologists on the West Coast, who prescribed a drug called Kineret.
They said they submitted to the insurance, and the insurance denied it.
Regents Blue Shield, which insures Lanita Bunce through her Boeing employment, called Kineret an investigational treatment that was not covered. In emails to King 5, two of Chanel's treating physicians said the drug is known in rheumatology circles for effective treatment of specific cases like Chanel's. After 3 weeks of insurance denials, Chanel took a turn neither her doctors or insurers could have predicted. Several of her major organs failed. Her physician started her on Kineret without insurance. It helped, but not enough.
If Chanel would have had it 3 weeks earlier, we might not be where we are today. And because of it, I still feel that had she had it, that she might still be alive.
Chanel's death here at the UW struck a raw nerve in the rheumatology community, where doctors say insurers routinely gamble with patient health.
Deep breath in and out now.
Dr. Jeff Peterson heads the Alliance of Rheumatologists in Washington State.
Every year at our meeting, this is the #1 topic. Every day, my nurses are dealing with patients not being able to access the medications that are necessary to treat these really severe and sometimes life-threatening illnesses.
A new generation of expensive drugs, including Kineret, can save rheumatology patients from lifelong crippling illness. Dr. Peterson says insurance companies have targeted costly drugs that patients may need for the rest of their lives.
If they can keep a patient from getting one of these medicines for 1 month, it saves them $1,500. If they delay or deny enough cases, it could be millions of dollars every quarter. Okay, Chris, I'm going to listen to your heart and lungs.
Chris Grant got a prescription for a drug that worked well in the past to control his inflammatory disease. But this time, his insurer denied coverage for 6 months.
Let's take a look at this spot right here.
During which his right eye started bulging and other painful symptoms flared up.
I was confused. I didn't understand why they would want to prolong my suffering when this drug had worked for me before.
Dr. Peterson says rheumatologists in Washington and Oregon are so outraged by these delay tactics, they've begun collecting data to draw up insurance company report cards.
We're going to publish that data, and we're going to rank the insurance companies like they rank doctors.
We first evaluate a medication and look for reliable scientific evidence that it has a proven value.
Sean Karbowitz is a doctor of pharmacy at Regents Blue Shield who signed the rejection letter for Chanel Bunce's coverage of Kineret.
The scientific evidence around Still's disease is evolving.
Karbowitz says there are still many scientific questions to be answered about the use and effectiveness of some of the new drugs, and all insurers have a duty to control costs.
We do want to cover prescription medication that's been proven to be effective and is safe for our patients.
By law, insurers can't reject a medication just because it isn't FDA approved. They have to consider other evidence as well. Specialists say their expertise provides that evidence, but their treatment plans can't work if medicine isn't delivered on time.
You would always fight for your kid, and this was one fight I didn't know what to do. So I feel like I let her down.
Chris Ingalls, King 5 News.
It's not just rheumatologists who are frustrated. In March, the King 5 investigators found a respected local cardiologist frustrated by insurance companies who routinely denied the prescription he was writing for his patients for the cholesterol-lowering drug Lipitor.